Just to summarize the point I was making is that when I was at Johns Hopkins Bloomberg School of Public Health, getting my master's, we went over the data for statins regarding, does it improve um, um, morbidity, mortality, and really they had a kind of, I would just summarize it to say that they bent the data, which was pretty sketchy, minimal, into a pretzel in order to present it to us to show that there's some benefit. And he's like, this is all there is, but this is significant, statistically significant. He was pretty defensive about it. But if, anybody sort of coming at this and looking at it without knowing anything would not be very convinced that it's anything, it was significant. But yet we're all brainwashed into thinking the statins is so great. Um, and then obviously the question which has never been addressed is what about the side effects of lowering your cholesterol that low?
Hmm.
Does it have any association with dementia? Seeing that, dementia is a problem with Schwann cells in your brain.
Hmm.
Schwann cells are the cells that wrap themselves. It's like kind of like the cells are like a pancake. It wraps themselves around the axon in the brain. And the Schwann cells are the majority, vast majority. I believe it's like 80%, something like that. It's a very high percentage of cholesterol. So if you decrease your cholesterol, certainly there's a biologic plausibility that you could have a problem with your Schwann cells. If you have a problem with your Schwann cells, you have brain disease.
Yeah.
And so there's a lot of people talking about it. There's a lot of sort of theoretically it makes sense, but what's sometimes in medicine when you want to look at something and you look into PubMed and you find that there's nothing there on it, that by itself tells you there's like a smoking gun there. Because, whenever there's nothing there, I mean, there's no art because it's such a vast array of articles published and every topic in the world that when something's absent, that should make people raise their eyebrows. And, other things that are absent is like, the vegetable oil, canola oil, palm oil, uh, all these all these seed oils. There's almost no data looking at the health benefits of it. Meanwhile, we
Right.
were told in the early 1980s how healthy it was. So all the restaurants switched over from lard to or tallow to the seed oils, and we were all told it's healthier. And that's it. But there's still to this date, there's some articles that they're in the scientific literature because I've looked it up. There's some opinion articles there. You'll find experts saying how great it is and how healthy it is, and talk about the difference between polyunsaturated, monounsaturated fats and saturated fats and that kind of stuff. But that's the theory behind why it's healthy. But you need the outcome studies of what are inflammatory markers, how those different in the two groups between seed oils and say natural oils from whether it's from olives or animals, comparing various outcomes. They should look at, cholesterol, um, BMI in a population of people, mortality data, all that kind of, there's plenty of outcomes you can look at, and it's never been done. So that's another example. There's many examples, but there's another example of like, it's absent from the literature. So
Right. And you know what? We have been born into it's almost like before we learn how to read or write, we hear that our cholesterol needs to be below a certain level. I mean, I knew about cholesterol, in junior high school. I heard that's sort of when it all started. It was like the mid to late 80s. I don't know if there's a correlation there, but suddenly everything was about like low fat and non-fat and skim and all this stuff. And we know from other countries, we know for a fact that European countries have very high intakes of saturated fat and very low heart disease compared to the United States. So that didn't work.